Just over. Files that is. So we welcome all the parents who have come all the way from such a long distance. Uh, Rather, I would say it's a very historic event happening in a medical college. Nagaraj, student group. By now, of course, there must be, we cannot say that we are the one and only one institute doing like this. There must be definitely, but we, on our part at TNMC, are trying that, we keep a good connect with the parents, keep you updated. Not that one day before the university exam, we inform you that no, his attendance is this. Rather, you must have observed that you are receiving all the attendance updates, almost daily updates. By that, you get a fair idea about the ward's progress. I just wanted to ask you, anybody here who is not there on the parents group, still not there? There is a WhatsApp group of parents. So we have with us the three heads of department of anatomy, physiology, and biochemistry, and I'll request them to speak a few words. Firstly, I would like to call upon Dr. Veena Dias, who is HOD of biochemistry.
A very good morning to the senior faculty members who are present here, head of the Department of Anatomy, the other faculty members, head of the Department of Physiology, as well as you, dear parents who are here. A warm welcome to this parent-teacher meeting. Yes, as Dr. Yuvraj said, it has been historic. We have never had PTA meetings, and this is the first time we are having it in TNMC. As you know, that parent-teacher meeting is a regular activity of all academic institutions. And it is during this particular meeting that we need to have an open discussion between parents and teachers so that you can discuss your ward's concerns, his progress. I think you need to be open and honest regarding the strength of your ward, regarding his weaknesses, so that we can develop collaborative strategies and enhance the growth and development of your ward to become a good Indian medical graduate. We would also appreciate that you give us a feedback on our teaching technologies, on the logistics of the college, as well as if you have any concerns regarding hostel facilities or any other concern regarding this particular college, because it will help us to enhance these facilities as well as the teaching programs so that we will be able to give better educational motives to our future batch of students. Of course, this batch is almost finishing their curriculum. We have abided by the competency-based medical education curriculum. We have had ADCOM module covered. We have had integrated lectures, vertical as well as horizontal. We have had seminars. Whatever was the requirement of the competency-based medical education, we have seen to it that we have inculcated it in our curriculum. Still, if you have suggestions so that we make our teaching more interesting, we would appreciate that. Thank you. I really appreciate that you have come all the way to attend this meeting, and we are very grateful. All the three departments are very grateful that you are really concerned regarding your wards, and this attendance of yours is a mark of that. Thank you.
Thank you so much, madam. And I would request the acting head of physiology department, Dr. Sonali Pandey, to speak a few words.
गुड मॉर्निंग, नमस्कार सगळ्या पालकांना. तुम्ही फार लांबून आला आहात आणि वेळ काढून आलात त्याबद्दल तुमचे खरंच आभार. तुमच्यासारखीच आम्हाला पण तुमच्या मुलांची काळजी आहे. तर मी परत रिपीट करणार नाही जे मॅडमनी सांगितलं. वी हॅव डन आवर बेस्ट, सो व्हॉट एव्हर वी कुड डू वी हॅव डन. अँड लेट मी टेल यू, युअर स्टुडंट्स हॅव ऑल्सो, युअर वॉर्ड्स ऑल्सो हॅव डन टू देअर बेस्ट. तुमच्या मुलांनी पण त्यांचं बेस्टच दिलं आहे. तर होऊ शकते काहींचे मार्क कमी असतील किंवा काही असेल, तर तुमच्याकडून हीच अपेक्षा आहे की तुम्ही त्यांना मोटिवेट करा. यू हॅव टू जस्ट मोटिवेट देम. फर्स्ट MBBS इज युजली अ बिग हर्डल. हा एक मोठा पडाव असतो आणि मुलांना ते पार करणं एवढं सोपं नसतं. 12वी नंतर फर्स्ट MBBS चा जो कोर्स किंवा सिलेबस असतो तो एक मोठ्या समुद्रासारखा असतो. तर मुलांना ते पार करणं एवढं सोपं नसतं. घरापासून लांब आलेली असतात मुलं. तर आय हॅव फुल फेथ अँड कॉन्फिडन्स इन माय स्टुडंट्स. तर तोच फेथ आणि कॉन्फिडन्स तुम्ही पण तुमच्या वॉर्डमध्ये मुलांमध्ये ठेवा. मोटिवेट देम. This 1 or 2 months which is still left for the university exam, I am telling you and I'm telling the students out there that you will unleash a new potential in you. तुमच्यामध्ये एक जो स्पार्क आहे तो तुम्हाला आश्चर्य वाटेल, तो घडून येईल आहे आणि यू विल डू युअर बेस्ट इन द युनिव्हर्सिटी एक्झाम्स. तर सगळ्या पालकांना हे सांगायचं आहे की तुम्ही जेव्हा मार्क बघाल किंवा अटेंडन्स बघाल काही कमी जास्त असेल तर नो दॅट युअर चाइल्ड हॅड लॉट ऑफ चॅलेंजेस. सो आवर जॉब अँड आवर ड्युटी इज टू जस्ट बूस्ट देम. This 2 months is a big challenge for you all and for them also. So our job is, of course, as teachers, we are going to do our best. पण तुमच्याकडून पण तीच अपेक्षा आहे. Okay? And of course, as Madam ने सांगितलं आहे की we require your feedback. Your valuable feedback will help us, change our curriculum or bring those small little changes here and there. We have given our best, as I said, but तुमच्याकडून जे आम्हाला मेल feedback, तुमच्या मुलांकडून, maybe if they are hesitant to tell us, as parents they might be sharing certain things with you. तुमच्यावर जास्त शेअर करत असतील ते, तर जे काही असेल ते आम्हाला नक्कीच फीडबॅक द्या, बिकॉज दॅट विल हेल्प अस टू गो अ लॉंग वे अँड इम्प्रूव्ह अवर करिक्युलम अँड मे बी ब्रिंग दोज चेंजेस. तर परत एक वेळ तुम्हा सगळ्यांचा धन्यवाद की तुम्ही इथे आला, लांबून आलात. सो थँक्यू सो मच.
Thank you, Dr. Sonali. And I would request, so before I call upon Dr. Shyam Kishore, the professor and head of anatomy, let us welcome with claps our academic dean, Dr. Ravika Patil Madam. She is, such a support to all of us. So Dr. Shyam Kishore sir will be updating you about the new NMC guidelines which have come in. So over to Dr. Shyam Kishore.
Good morning, everybody. The new NMC guidelines now no longer due. Let October 2024, the whole students will join here. So it is applicable from them onwards. One of the things is regarding passing marks. They have to get 50% or 40% passing in theory, separate 40% passing in practical. But together it should be 100. There should not be like 40 plus 40 is 80. You can get 40 in theory, 60 in practical, or 60 in theory, 40 in practical. Together it should be 100. But minimum is 40 in each. In case your student is 39, 61 is not considered as far. Because 40 has not been. That is one point about passing. Regarding attendance, university and NMC both have said 75% attendance in lectures, 80% attendance in practical. That is what is the minimum requirement. For those who have for that 20% less for practical and 25% less for theory. These are all the reasons put together including medical leave. There is no separate staff medical leave. Gatherings, public functions, everything is counted as up to a limit of 20%. Otherwise, the competency is not covered. For those who are falling short of the required university, we have got more classes lined up till 17th of this month, so coming month, July. At that time, they have to make up that 35 people. For those who have come close to that target but not fulfilled it, we have got something called as remedial classes. Remedial classes will be taken after the projects in the university exam to make up for the deficiency. So there, the remedial classes are only for those who have crossed at least 60% barrier. There's no point in saying that I've crossed 50%. Now, how will I make up 70%? So that is the rule of NHC. 60% minimum requirement at the end of July 17. If they have crossed 60%, then they are allowed for remedial classes. We have already decided how much are they short right now till yesterday, and how much they require to attend more classes to make up for the classes. Those who are not reaching 60% by the end of July 17, we have to stay back for 1 whole year. They are not allowed for the regular exam, they are not allowed for 50-minute break. I am sure almost all of you will reach by the end of July at least 60%. So they are eligible for the remedial class. Afterwards, you can continue the evening. Thank you very much. Thank you.
थोडं मराठीमध्ये भाषांतर करून सांगतो सर जे बोलले ते की प्रिलिमची परीक्षा सुरू व्हायच्या आदल्या दिवशीपर्यंत मुलाचा अटेंडन्स 60% पाहिजे मिनिमम. हा नवीन नियम असा आहे. तो जर का 60% नसेल तर तो विद्यार्थी या वर्षीची विद्यापीठाची परीक्षा ऑगस्ट मध्ये आणि त्याच्यानंतर सप्टेंबर ऑक्टोबर मध्ये होणारी सप्लिमेंटरी दोन्हीसाठी एलिजिबल होत नाही. कारण हा जो सिलेबस आहे हा कॉम्पिटन्सी बेस्ड सिलेबस आहे. याचा अर्थ त्यांनी कॉम्पिटन्सीच अटेंडच केलेली. त्यामुळे त्याला ज्युनियर बॅच बरोबर जॉईन करायला लागतं. घाबरू नका. तुमच्यापैकी फार एखाद दुसरे विद्यार्थीचीच अशी केस आहे. आम्ही सगळं चेक केलं, त्यामुळे तुम्हाला आम्ही यात घाबरवत नाही. घाबरण्याचं कथा कारण हे जे मी नेक्स्ट सांगतो, जे 60 ते 75 थिअरीमध्ये आणि 60 ते 80 या रेंजमध्ये जी मुलं आहेत, जसं सरांनी सांगितलं, ते आता रेमिडियल क्लासेससाठी एलिजिबल. हे रेमिडियल क्लासेस प्रिलिम नंतर सुरू होतात. ओके, त्यामुळे हे का मी तुम्हाला सांगतोय की आता त्यांना ते अटेंड करायला लागणार. तुम्ही इकडे सगळी तयारी केली असेल की आता प्रिलिम झाला की मुलगा मुलगी घरी येईल, मग मी त्याला चहा बनवीन, रात्रीचं कॉफी बनवून देईन, हे ते नाही. कारण त्यांनी इथं आता अटेंड केलं नाही तर त्याला आता इथेच राहायला. हा, मग आम्हाला असे हट्ट अजिबात करायचे नाही की सर बघा ना मी अभ्यास करून देईन, तुम्हाला व्हिडिओ कॉल करून दाखवीन तो कसा अभ्यास करतोय. नाही नाही, आता त्याला हे सगळे रेमिडियल क्लासेस कुठपर्यंत विद्यापीठाच्या परीक्षेच्या आदल्या दिवशीपर्यंत आता हे अटेंड करायला. जर का अटेंड केलं नसेल तर आता ते मग 60 वरनं सरकत 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 75 पर्यंत गेलं आणि 80 पर्यंत प्रॅक्टिकलचा अटेंडन्स गेला तर तो त्याला आम्ही हॉल तिकीट देणार. हे 3 दिवस आधी हॉल तिकीट विद्यापीठाच्या परीक्षेच्या आधी दिलं आणि ते होऊन जातं खूपशा विद्यार्थ्यांचं. ते नाही झालं तर एक फक्त चांगली गोष्ट अशी असते की असा विद्यार्थी तो मग ठीक आहे एखाद्या विषयात, सपोज अनाट फिजिओ बायोकेम मधला एखादा विषय तर तो लगेच 1 महिन्याने होणाऱ्या सप्लिमेंटरीला बसून आपल्या रेग्युलर बॅच बरोबर जॉईन होऊ शकतो. ज्यांचं 75 आणि 80 ज्यांचं क्रॉस झालेलं आहे आत्ताच, त्यांचा अटेंडन्स आम्ही फ्रीज केलाय. त्यांना तुम्ही घरी घेऊन जाऊ शकता, चहा कॉफी पाजू शकता, रात्री नूडल्स बनवून देऊ शकता, सगळं 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 ते लाड तुम्ही सगळे करू शकता. ओके, बर. आता मग जे मध्ये आहेत थोडेसे 71, 72, मग त्यांना 1 आठवडा इथे राहायला लागेल. सर एक किती आवर्ससाठी? 5% अटेंडन्स वाढण्यासाठी 1 आठवडा अटेंड करायला लागतो. म्हणजे जर का 70 वर असेल तर ते 75 वर जाण्यासाठी 1 आठवडा, 80 वर जाण्यासाठी 2 आठवडे, असा हा हिशोब आहे. डॉक्टर श्यामकिशोर सर, तुम्हाला लक्षात आलं असेल ते जे गुगल स्प्रेडशीट पाठवतात त्याच्यावरती सर रोज संध्याकाळी घरी जायच्या आधी सगळा अटेंडन्स अपडेट होतो. तुम्हाला आज आपला मुलगा कॉलेजला आलाय की नाही हे पण कळतं. खरंच सरांसाठी आपण टाळ्या वाजवल्या पाहिजे. त्याचबरोबर आपल्याकडे डिपार्टमेंट ऑफ बायोकेमिस्ट्रीच्या हेड आहेत डॉक्टर बीना डायस मॅडम. त्यांनी एक 12 ऑगस्टला इंटिग्रेटेड क्विज अरेंज केलेलं आहे, दोघांनी, सोनाली मॅडम आणि. तर आम्ही अख्ख्या सोनाली मॅडमनी फिजिओलॉजीचं क्विज किती तारखेला? 8 ऑगस्टला. म्हणजे या कॉलेजमध्ये अशा ऍक्टिव्हिटीज होतात. अख्ख्या मुंबईतलं सगळ्या कॉलेजेसचं इथं नायरमध्ये हे क्विज आहे आणि सगळेजण इथे येणार आहेत. मॅडम इज द चीफ, बीना डायस मॅडम बायोकेमिस्ट्री, चीफ फोर्स बिहाइंड द अनॅटॉमी फिजिओलॉजी बायोकेमिस्ट्री क्विज. हे फर्स्ट टाइम आपल्या कुठल्या हिस्ट्रीमध्ये असं क्विज होत आहे की क्विज मध्ये तिन्ही विषय आहेत आणि एका मेडिकल कॉलेजमध्ये अशा प्रकारचं क्विज होत आहे, जे की 12 ऑगस्टला होणार आहे. सो बिफोर वी प्रोसीड, I would request our academic dean to please come on the dais. Thank you. So before I call upon her to speak and address the parents, I would request Dr. Jayaben Charanya to introduce our academic dean. Dr. Lalita. Dr. Mobile sir.
Good morning, everyone. Good morning, madam. Good morning, sir. Good morning, Veena madam, Sonali madam. I'm very delighted to see all of you, and I'm here to introduce my very good friend and my colleague, Dr. Lalita Patil. Madam is academic dean, and she is additional professor in Department of Pathology in DN Medical College. Madam has 20 years of experience in pathology in various fields of pathology like oncopathology, gynec pathology, breast pathology, cytopathology, and quality in healthcare. And Madam is also ex-blood bank in charge of TN Medical College and BYL Nair Charitable Hospital. Madam has to her credit more than 35 national as well as
इथे ऑफ केलं ना. बोला. हे म्यूट केलं तर मग तिकडे स्पीकरचा आवाज बंद केला त्यामुळे त्याचे
Sorry for interruption. Madam has more than 35 national as well as international scientific publications, oral presentations, and in various conferences, Madam has been a supportive force for organizing conferences as well as an active faculty member in the conferences. Madam is also one of the author for Maternal Mortality, a lesson learned from autopsy book published by Springer Publication. Madam is NABL assessor. Madam is NABH assessor for hospital standards. Madam is also a postgraduate teacher. She is a PG guide and she is a PG examiner. And she is a life member of various organizations and professional bodies in the country, like Indian Association of Pathologists and Indian Medical Association. So may I request Madam to address parents? Dr. Lalita Patil.
सॉरी थोडे टेक्निकल
First of all, good morning to everyone, to all teachers and parents. I would like to thank Sir and Sir of Anatomy, HOD of Anatomy, Biochemistry and Physiology, and all the parents. All of you have gathered here to see की आपल्या मुलांचं काय चालू आहे. आता फर्स्ट इयर संपायला आलं. What is the next? What is the next? Okay, so we'll see in short. First of all, congratulations to all of you for getting admission to your students in this prestigious institute, Nair Hospital and BYL Nair Charitable Hospital, TN Medical College and BYL Nair Charitable Hospital. So congratulations to all parents. So like first, I will just go through it. Few things like लहानपणापासून पॅरेंट्सच्या मनात असतं आपल्या मुलांना डॉक्टर व्हायला पाहिजे, हे व्हायला पाहिजे, तर ते मुलांचं नसतं, ते पॅरेंट्सचं असतं की पॅरेंट्सला असं वाटतं आपल्या मुलांनी व्हायला पाहिजे. सो इट इज लाईक अ फर्स्ट means what the thoughts comes in the mind, it's of a parents. Okay, so your child has achieved this success, but this success story, your efforts as parents are equally important. So first, congratulations to you because it's all efforts ki your what you say, son or daughter got admission to this MBBS curriculum. Okay, so my child should become a doctor in a dream of parents. Then secondly, it is a dream of child too. The parents are inoculating this in the mind of child from the childhood. So you are a parent of a cream of society. जे आता डॉक्टर होणार आहे, आता जस्ट दिस इज द बिगिनिंग ऑफ युअर स्टुडंट्स, पण आता ते पुढे जाऊन नेक्स्ट सिन्स सेकंड इयर, थर्ड इयर,
थर्ड मायनर, थर्ड मेजर, इंटर्नशिप हे सगळं झाल्यानंतर they will complete and they will like a doctor. So your means you are a parent of this, they will be like a cream of society, they have the prestigious value and they are a next generation of our India. But one thing I want to say, every child is different because our 5 fingers are different, so every child is different, each and every student has a different capability. So your child's journey begins when they took admission to the Nair hospital. The journey of MBBS is like a mainly they go through the subjects like anatomy, physiology and biochemistry. So there's MBBS, Bachelor of Medicine and Bachelor of Surgery. That is from the first year to the internship. This is their means what you say, the journey is there from the first year till they complete their internship. So in that they have to means it's like a rigorous and transformative experience is there. So depending on that, they will develop their career. So they are the budding doctors. So basically the first year is important because they have to focus mainly on anatomy, biochemistry and physiology part of the human body. So one, it's like they understand properly, the concepts are clear. So it is easy for them to learn the clinical. So one should understand rather than memorizing everything. So their basics should be clear. So base should be strong to build a multi-story building. So that's why the first year is important. So that's why sir said, okay, they have to admit it is for every year is the MHS has made more than 75% in theory and more than 80% in practical. The attendance is compulsory, but it's like their base should be clear. So that's why if the anyone is less in attendance or internal assessment marks, so they have to take a drop. So till it is like they are doing from the reading books, they are doing practicals and this. But now from the second year onwards, second MBBS onwards, they will start attending the clinical postings. They will go to wards, they will attend the emerge and other. They will see the patient, means interaction will start. Patient बरोबर means patientचे symptoms काय आहे, patientला काय होतं, काय नाही. They will start seeing that. So from the second MBBS onwards, the budding doctor will feel proud and they will start observing clinical signs, patient communication, case history, and they will start attending their clinical postings like medicine, surgery, gynec, pediatric, ortho, radio, and other postings are there. Okay. So they will till means first year they are reading from the books, but now they will start from the real patient. So, but each and every patient has a what is the different this. So they have to learn. It's a learning lesson from them. It's like a learning lesson to them from each and every patient. So become a good doctor, one should practice clear, compassionate communication with patient, peers and seniors. So this capability should be there within the students. So they have to learn the art of history taking and explanation of diagnosis to the patient and to the colleagues. And they should have empathy. First of all, empathy is important. So, medicine is a team effort. Value the inputs of nurses, technicians, seniors, juniors, colleagues are important. So they have to learn. It's like a collaborative approach will be there to them from the second year onwards. Hence, they have to give respect and take respect. This profession requires the respect. If you give respect, you will receive respect. Okay. So this they will learn. Then learn professional etiquettes, punctuality, courtesy and accountability will be there. Also, they will develop a decision making and responsible behavior will be there. So, they will move from theory to practical. Means it's like a practice will be there to see, means how to take the history, how to do the examination. They will see the file, they will see the which are the procedures are carrying out, means what is their blood collection, how they are doing, how they are inserting the rice tube, how they are inserting the police tube, how the ECG are reading blood collect, then how the sisters are giving injection, everything they will start learning. Okay, so he will ask question, he do if he will be the treating physicians. Like if I am the treating physicians, what I have to do? The same thing they will learn. As I said, okay, they will see all the procedures, Vinay puncture, catheterization, suturing, CLW suturing, everything. So that's why this mentorship program is there. So we mentors. So this mentorship program is important to guide your child properly. So objective of this mentorship program to inform about this mentorship program, how it supports your students' development. So that's why this meeting, PTM is kept. So you may be asking why this mentors are going on. Because it's important, because the role of mentor, mentee and parents are equally, means it's like a each and every, means these are also important. सगळ्यांचा रोल आहे याच्यामध्ये, पॅरेंट्सचा पण आहे, स्टुडंटचा आहे आणि मेंटर्स तर आहेच. अगर तुम्ही पॅरेंट्स आहात, तुम्ही तिकडे असाल, पण ह्या वेळेला आम्ही असतो इकडे स्टुडंट्स बरोबर, काहीही झालं, काही स्टुडंटचं कंप्लेंट्स आहे, काही प्रॉब्लेम आहे, तर आम्ही फर्स्ट आमच्याचकडे येणार आहे स्टुडंट्स. सो आमचा रोल इम्पॉर्टंट आहे त्याच्यामध्ये. म्हणून तर मेंटरशिप प्रोग्राम आम्ही डिसाईड केलेला आहे की इच अँड एव्हरी स्टुडंटला त्यांचे मेंटर असलं की काही प्रॉब्लेम झाला तर मेंटरला अप्रोच करू शकणार ते. ट्रान्झिशन फ्रॉम स्कूल टू मेडिकल कॉलेज. तर स्टुडंटला वाटतं आता आपण स्कूल मधून बाहेर आलो, आता आपण कॉलेजला गेलो, पण हे कॉलेज म्हणजे काय? इट इज अ मेडिकल स्कूल. मेडिकल स्कूल आहे म्हणजे दे शुड हॅव अ डिसिप्लिनरी अप्रोच. ओके, सो दे हॅव टू लर्न हाऊ टू handle the academic, emotional and social support. So it will enhance the confidence, resilience and professionalism in your child. What are the goals of this program, mentorship program? To provide academic guidance and career counseling for your student. Then for personal development, emotional well-being. Also the development of the professionalism, the ethics. What are the ethics? Confidentiality of the patients or any other thing. How to maintain that? This ethics should be taught. Okay. Then communication skill means while taking history taking or doing examination, you have to ask patient. They have to take permission. की मी तुम्हाला एक्झामिन करू शकतो का? मी तुमची हिस्ट्री घेऊ शकतो? तुम्हाला हे आहे का? Means that communication skills they will develop and all the ethical protocols they will see. Then promote student engagement and reduce dropout. There are many dropouts and this is there. So if the mentorship program is there, they have any issues, they can contact their mentors. So this dropout we can reduce. So mentors will be all the faculty members starting from the first year to the third major. That's like all the clinical, paraclinical, all the faculties are there from the first year to the third year. So all the faculties, like 50 faculty members are there for 150 students. So 3 students for 1 faculty. So that way we have allotted all the mentors. So meeting frequency is like once in a month is there. Also one-to-one group discussion will be there. And as and when if the child required or student required any communication or any issue is there, he can approach to their mentor anytime. So there are the different ways of communications are there. So if it is required, okay, child is not to performance or any other emotional or any other problem is there and he is not stable. So communication can be done to parents through higher authorities. But it's like TN medical, the administration can do the communication via mail, or we will send the mail, letter, or this. So these are the role of mentors: motivation, direction, guidance, advice, everything. First of all, we are doing the coaching to them. So provide academic advice and career direction. Help with time management and study strategy. And support the student when they are in very stressful situation. Basically, because they are away from home, they are away from parents, they are away from their friends, their family, so sometimes they feel some emotional breakdown and anything. So that time, the support of mentor is also important role. Good morning, sir. The support during stressful situations, like emotional breakdown is there. Sometimes at time of exams, the clinical exposure, anything, student feels depressed. So that time the role of mentor is important. That encourage the professionalism and ethical practice. So the mentor will as a work like a bridge between the student and the administrative authority. So student has to have an open communication and give a proper feedback. They have to attend whatever the meetings had been scheduled with the mentors. They have to attend all the meetings. They have to share their whatever the problems or issues related to academic or personal, any honestly. They have to complete their logbook. They have to complete their logbook, attend their classes as sir said, Shyam Kishore sir said, they have to complete everything and they have to maintain their record of attendance and internal assessment marks. So they have to attend everything, classes, practical, exams, religiously to maintain attendance more than 75%, and it is compulsory by MUHS and NMC. Now, what is the role of parents? So encourage participation in the mentorship program. Mainly, as a parents, you have to tell your students or tell your child to properly engage in the program of mentorship program, support students emotionally during any high or lows are there in their life. So it's like it is not की नाही तुला हे करायचंच आहे असंच करायचंय हेच घ्यायचंय तुला study. No, you have to see how the child is doing. Depending on that, you have to force them. Maintain communication with the higher authority via mentor if you need, or you can do the direct communication also. Avoid excessive pressure. Understand the demand of medical training. Avoid over expectation from the child. To counsel student to refrain from any type of addictions, because many of the students, they live away from home, so they develop many types of like addictions, like drinking or many addictions are there. I'm not going to say in detail. So you have to be in touch and see to it your daughter or your son is not developing that's bad habits. If you suspect anything, so kindly communicate. So what are the outcomes and benefit of this program? So improve academic performance and emotional stability of your child. Early identification of struggling student is there. So we can guide them. We can give extra lectures or anything practical is needed. So we can help them, their student, enhance communication skill and professionalism. So it will better preparation for the post graduation. And whatever it is there, the mentorship interactions are confidential. We are not going to disclose anything to anyone. So whatever the mentor is there, so they will not disclose anything of that student to anyone. So safe space for student to expose concern, whatever it is there. Only in a few exceptional cases, like some mental health crisis, anything is there, that time that mentor has to inform to the administrative authority. The feedback and monitoring is important. This program is monitored by the coordination committees. NEU committee is there. That committee is monitoring this program. So regular feedback is taken from the students and mentors as well. So adjustment made based on the evolving needs. So today's student is the tomorrow's healer. So hence student should be healthy, not only physically, mentally and spiritually as well. A healthy doctor can care better for patients. So medical life is demanding. It find healthy outlets like exercise, yoga, meditation. They can develop their hobbies like drawing, art, any other. If they are good in sports, they can do that. With support to each phase of life through this mentorship program. So, thank you everyone. Thank you for patient hearing. If you have any queries, you are free to ask. We are there to support your child and your answer to your queries too. Thank you.
Thank you, Dr. Lalita Patil Madam, for so nicely giving a brief of how the journey ahead is going to be and how this mentor system is going to be a very good support system for the students. So, so we have with us our acting dean, Dr. Satish Dharav sir. Sir is the professor and head of surgery department, and he has been our academic dean for many years, and now he is looking after the postgraduate section of our of our college. Sir is a general surgeon practicing for past 41 years. 41 years of experience of surgery. म्हणजे आपण अशा लोकांबाबत बोलतो की हे डोळे बंद करून सुद्धा सर्जरी करू शकतात. And apart from that, sir is a very good, very nice human being, very approachable. Your students at the end, of your course will definitely talk about Satish Dharav sir, that yes, sir is very approachable. Rather, whenever I am in problem, I approach sir, and he always has a solution for that. And we spend a lot of time together, discussing on some issues and how we can resolve. And he was very busy today. He was in midst of a skills workshop. So not only he is a great surgeon, he creates surgeons also. So the skill lab, we have a cadaveric skill lab in our college, which has a -20 freezer. -20 freezer means you take out the cadaver from that and you take a cut, it bleeds like a live person. And sir conducts workshop there where he trains the budding surgeons, even the other surgeons who want experience. So he is teacher not only for UG, not only for PG, he is teacher for the surgeons. So I'll call upon the teacher of surgeons, Dr. Satish Dharav sir, to guide us.
Thank you. Thank you for nice words. I am really, flattered by your words. Anyway, it is just a pinch of salt, I think. Welcome all of you, all parents of our beloved students. Many of you are from outside the institution and outside the city, and it may be the first time that your child is staying away from you. So you always have worry who will take care of them. So in this mentor-mentee program, the mentor is supposed to be the local guardian. So obviously we can't replace parents, okay? But that is one person who to some extent can, fulfill your absence from this city. For those of you who are from Mumbai and the children are going to keep staying in Mumbai, you are always worried whether there will be ragging in the hospital. In this competitive world, when all toppers are coming to big Mumbai colleges, how my child will perform? So again, mentor is the solution, where child can share his problems, whether some senior is troubling him, or if he is not able to understand something from the curriculum, there is some problem in the hostel, or any kind of problem. So this mentor-mentee system is has been there on paper for a long time, but this time NMC has insisted that it is implemented very, very strictly. For one mentors, there will be mentees across generations, somebody from first year, somebody from second year. So it is expected also that there will be more friendship among people or students across different classes, first year, second year, third year, etc. So please make your child attend or get in liaison with the mentor, okay? And you have to also supervise your children as to what they are doing. And please feel free to contact us anytime. As far as I am concerned, though I am academically in PG, and maybe students come to surgery little later, first year, they don't have these clinical branches, but I am available for my student anytime if they have any problem. So again, welcome to Nair Hospital and wish you all the best, and please feel free to contact us anytime when you or your child has any kind of problem. Because nowadays there is a lot of mental health issues coming up with medical students, and there are a lot of pressures and stresses of life. Okay, so please feel free to contact us anytime. Thank you so much.
Thank you, Dr. Satish Dharup, sir. So before we go to the next event where parents will be going and meeting the teachers, let me explain how we are going to do this. But before that, I would really like to thank Dr. Lalita Patil Madam and Dr. Satish Dharup sir to take out time from their busy schedule and making it here for the parents. By now, the parents must have understood the kind of support system that is there at the NMC. So I would request any parent who wants to come and speak here. कोणाला बोलायची इच्छा आहे? 2 शब्द मराठी, हिंदी, इंग्लिश. तुम्हाला कसा वाटला तुमचा अनुभव?
तुमचे काही क्वेरीज असेल काय तरी येऊन तुम्ही विचारू शकता, असं काही नाहीये.
त्यांना काही क्वेरीज नाही, दे आर व्हेरी हॅपी अँड सॅटिस्फाईड. ओके, सो नाउ या तिकडून त्या बाजूला.
गुड मॉर्निंग. तर मी नांदेडहून आलेलो आहे. तर मी यासाठी मेंटर आणि मेंटी हा जो आपल्या भाषेमध्ये दत्तक पालक की जे आहे, तर ते आपण जसे आतापर्यंत पालक होतो, ते कॉलेजनं आपल्या मुलाचं पालकत्व या ठिकाणी स्वीकारलेलं आहे. आणि प्रथम आमच्या सर्व पालकाकडून नायर अकॅडमिक नायर कॉलेजचं आणि ह्या डीन, पूर्ण फॅकल्टी मेंबर यांचं सर्वांचं आमच्या सर्व पालकाकडून खूप खूप आम्ही त्यांचं अभिनंदन करतो. सर्वांच्या एकदा मी स्वागत. सर, आम्ही आमचं एक भाग्य समजतो की असे एवढ्या मोठ्या मेडिकल कॉलेजमध्ये असा मेंटर मेंटीचा कार्यक्रम राबवून की प्रत्येक मुलाची आमच्या जे काळजी घेतात की अटेंडन्स पासून त्याचे अकॅडमिक्स पूर्ण मार्क्स वगैरे प्रॅक्टिकल पासून काळजी घेतात, त्याबद्दल आम्ही की पहिल्यांदा या ठिकाणी आम्ही धन्य झालो की या कॉलेजची चॉईस निवडली, आम्हाला हे कॉलेज मिळालं, त्याबद्दल आम्ही खूप या ठिकाणी समाधान झालो आहोत. त्याचबरोबर की हा जो माझा मुलगा या संदर्भात सर्वां जे काही शेअर करतो त्याबद्दल आम्ही पालक या नात्याने की या अकॅडमिक कॉलेजच्या संदर्भात आम्ही खूप समाधानी आहोत आणि असंच आम्हाला या ठिकाणी सहकार्य हे लाभेल आमच्या मुलांना. आणि नक्कीच आता सरांनी जे म्हणले होते की मॅडमनी जे याच्यामध्ये पीपीटी आम्हाला दाखवलं की एक क्रीम एक सोसायटीमध्ये की नक्कीच ते चॅलेंजेस स्वीकारण्यासाठी यासाठी आमची मुलं बाहेर पडतील. हा आमचा आज या ठिकाणी विश्वास वाढलेला आहे. आणि प्रत्येक ठिकाणी की जे काही स्लो लर्नर आणि ऍडव्हान्स लर्नर साठी रिमिडियल क्लासेस जे कॉलेजनं अटेंड केलेले जे काही शेड्यूल आम्हाला पोहोचलेलं आहे, शेड्यूल आज व्हॉट्सअप ग्रुपवर शेड्यूल आलेला आहे, त्याबद्दल सर की आम्ही हार्ट मनापासून खूप धन्य झालो आहोत. आणि ही रिमिडियल क्लास बद्दल की रिमिडियल क्लास फक्त कागदोपत्री दाखवले जातात, पण या ठिकाणी शेड्यूल की तुमचा मुलगा आम्ही सोडणार नाही की एवढ्या हक्काने त्याची तयारी करून घेतात, त्याबद्दल की आम्ही ह्या कार्यक्रमाला आलो. हा कार्यक्रम खूप चांगला झाला आणि त्याबद्दल आमच्या सर्वांकडून खूप खूप धन्यवाद, तुमचे अभिनंदन.
थँक्यू सर. काय ना की स्वतःची पाठ माणसाला थोपटता येत नसते आणि त्यामुळे असे कोणीतरी पालकांनी 2 शब्द जरी बोलले तरी आम्हाला बरं वाटतं, आमचाही उत्साह वाढतो. कारण हे जे टीचर्स इथं राबत असतात त्यांचा एक थँकलेस जॉब असतो. म्हणजे आम्ही फक्त एक सगळ्यांनी प्रायव्हेट प्रॅक्टिस सोडून वगैरे इथे टीचरचा जॉब स्वीकारलेला असतो. असं नाही की आम्ही मर्सिडीज बेन्स मध्ये इथे येतो. ती ऑपॉर्च्युनिटी आम्ही सोडलेली असते कधी जेव्हा आम्ही टीचर व्हायचं ठरवलेलं असतं तेव्हाच. तर आमचं धन हे स्टुडंट्स आहेत आणि त्या स्टुडंट्स त्या पॅरेंट्स यांचे आशीर्वाद हेच आम्हाला हवे असतात. So now I'll just explain how things are going to be. की या 502 हॉलमध्ये अनॅटॉमीचे टीचर्स पहिल्या लाईन मध्ये बसलेले असतील यापासून या एंड पर्यंत. रोल नंबर 1 ते 30 तिथं लिहिलेलं असेल 31 ते 60 असं. आणि 502, 504 आणि 506 मध्ये फिजिओलॉजी आणि बायोकेमिस्ट्रीचा स्टाफ मार्क्स आणि अटेंडन्स घेऊन बसलेले असतील. 1 ते 50 504 मध्ये 1 to 50 in 504, 51 to 100 roll number, their marks can be seen in 506, and 101 to 150 in 508. So parents need not come here only for anatomy. They can go for physiology, biochemistry, seeing the marks first. The teachers will be in a position. You can be seated there. Till then, I'll just tell our postgraduates or teachers to just vacate those halls, get the students out. So that the parents can go and be seated and then take turns. आता तुम्ही शाळेमध्ये पॅरेंट टीचर मीट अटेंड केलेलं आहे, तिथे ती टीचर बसलेली असते पुढे टेबलवर, मग आपण आपलं वाट बघत असतो. तसंच थोडस होईल. अँड आफ्टर 11 o'clock, once you see the marks, we have informed all the mentors. This college, we are also now kind of in a process of renovation. Our auditorium is under renovation. Still we are kind of organizing all these events and online relay. So now to meet the mentor, we have given the option to the mentor because some of the mentors may be in the operation theater also. तुम्हाला तिथं ओटी मध्ये पण जाऊन बाहेर त्यांना भेटायला लागेल. सम मे बी इन ओपीडी, सम मे बी इन द लॅबोरेटरी. तर सगळी त्यांनी आपला जो ग्रुप बनवलाय छोटा स्टुडंट्स बरोबरचा, त्याच्यामध्ये दे हॅव टोल्ड की मला इथे येऊन भेटा. एखाद दुसरा मेंटर कदाचित अवेलेबल नसेल, तो सुट्टीवर असेल, त्याला वी डोंट वॉन्ट टू फोर्स मी. सो before I close this session, I would really like to thank all the parents also. All the parents who came all the way. मी आणि शापकिशोर सर आम्ही असंच रँडमली 3 महिन्यापूर्वी एक दिवशी असं म्हटलं की सर आपण करून टाकूया हे. आणि 28 जून सर म्हणाले बघ 2 महिने आधी रेल्वेचं रिझर्वेशन उघडतं त्यामुळे आपल्याला आधीच इन्फॉर्म केलं पाहिजे म्हणून आम्ही जानेवारीमध्येच इन्फॉर्म करून ठेवलेलं सगळ्यांना. आणि बायोकेमिस्ट्री फिजिओलॉजीचा जो सपोर्ट मिळाला आम्हाला याच्यासाठी आणि संपूर्ण स्टाफ म्हणजे गेले 3 दिवस आम्ही काहीही करत नाही, आम्ही फक्त कॅल्क्युलेशन करतोय कोणाचं किती, कोण 60च्या खाली, कोण 60च्या वर, कोण 75, कोण 80. आम्ही जाऊन आमच्या कॉलेजच्या डीन सरांशी सुद्धा बोलून आलो आणि सरांनी इतका सपोर्ट दिला, डॉक्टर शैलेश मोहिते सर. ते म्हणाले की आपल्याला जेवढं मुलांना करता येईल, जर मुलगा जेन्युइन असेल आणि काही कारणास्तव आजारी पडलाय, कोणाला फ्रॅक्चर झालंय, आपण त्याच्यासाठी क्लासेस घेऊ, त्याचा जे बोललेला पोर्शन आहे तो आपण कम्प्लीट करून घेऊ त्याच्याकडून. असं नाही की आपण आपलं जस्ट नाही नाही ते आम्हाला तसलं काय सांगायचं नाही, आम्हाला काही माहिती नाही, असं अजिबात अप्रोच इथं कोणाचं नाहीये. आम्ही पूर्ण सपोर्ट करू, पण तुम्ही देखील नॉट ओनली नाव, आता परत आम्हाला तुम्ही भेटणार नाही कारण आम्ही फर्स्ट इयर पास झाल्यावर मुलं आम्हाला ओळख देत नाहीत, तर पॅरेंट्स तर तुम्ही इथून पुढे जसं दोन्ही अकॅडमिक डीन्सनी तुम्हाला सांगितलं तसं त्यांच्यावरती पूर्ण लक्ष ठेवायचं. सगळ्यात महत्वाचं अटेंडन्स, जोपर्यंत तो रेग्युलरली अटेंड करतोय तर कुठे ना कुठेतरी काहीतरी आतमध्ये जातंय, अभ्यास व्यवस्थित होत आहे का, ऍडिक्शन्स, तुम्हाला त्याच्या 4 मित्रांशी कॉन्टॅक्ट ठेवा, ते मित्र म्हणजे सीसीटीव्ही कॅमेरा असतील तुमचे चांगले मित्र, आणि काय चाललेलं आहे हे तुम्हाला आम्ही आहोत मेंटर सर मॅडमनी सांगितलं तसं आम्ही सगळा सपोर्ट करू, पण तुम्ही देखील तुमचं पार्टिसिपेशन देखील तितकंच पाहिजे. आणि जे मेंटर्स आहेत त्यांना तुम्ही आज भेटा, त्यांच्याशी कनेक्टेड राहा, पण त्याचबरोबर लॅक्सिटी नका येऊन घेऊ, अरे आता मेंटर आहे चला आता आपल्याला काही टेन्शन नाही, तसं नाही. तुम्ही तुमचाही इक्वल रोल आहे. तसं आपण म्हणतो ना की एक मूल घडवण्यासाठी अख्खं गाव लागतं, तसंच एक डॉक्टर बनवण्यासाठी आपल्याला एक मेंटर लागतो, एक अकॅडमिक डीन लागतो, 3-4 HODs लागतात, 10-15 स्टाफ लागतात, पण त्यात एक पालक हा सगळ्यात महत्वाचा. म्हणजे ती कळकळ तुमच्याकडनं आली पाहिजे, आमच्याकडनं डेफिनेटली सपोर्ट सिस्टीम मिळेल. तर एवढं बोलून आपण हा इथं आता थांबूया. आणि आता तुम्ही वेगवेगळ्या हॉल्समध्ये जाऊन सगळ्यात अर्ध्या जणांनी इथंच जरी थांबलं तरी चालेल, रादर आय वुड ऍडवाइस की 1 ते 25 जे रोल नंबर्स आहेत त्यांनी इथेच थांबावं, रादर 1 ते 50, आणि बाकीच्यांनी 504, 506, 508 मध्ये जाऊन मग परत यावं त्यांचे अनॅटॉमीचे मार्क्स. थँक्यू सो मच. थँक्यू.